A public consultation is taking place on the future of urgent care services in Durham Dales, Easington and Sedgefield. We want to hear your views about our proposals for improving services. Now's your chance to have a say on the future of daytime urgent care services and minor injury services. NHS Durham Dales, Easington and Sedgefield Clinical Commissioning Group are running the consultation. We are responsible for planning and buying health services on your behalf. Urgent care refers to when the health service provides urgent advice, diagnosis and treatment quickly and unexpectedly for needs that are not considered life-threatening. Emergency care is not part of this consultation. Examples of emergency care are 999 calls and use of A&E in hospitals. The aim of the proposed changes is for us to provide simplified urgent care services so you get prompt treatment or advice, and to make the best use of medical services and workforce without adding unnecessary pressure on A&E departments. We want to make sure urgent care services are retained locally, are as close to people's homes as possible, and are equitable across Durham Dales, Easington and Sedgefield. It also has to be high quality, available 7 days a week, and able to meet the needs of a changing population, many of whom we know have at least one long-term condition, such as diabetes or respiratory disease. We know from listening to patients that current services can appear complex and confusing. This is inconvenient and frustrating for patients and can lead to poorer health outcomes. We need to make things simpler for the public and reduce waiting times. We are required to review services to ensure they meet patients' needs and are value for money. We're also looking to make better use of the NHS 111 telephone service. This is where trained advisors assess patients, advise what to do and book appointments. Our proposals would provide a joined-up service where GP surgeries will look after you if you were poorly during the day. GPs could also provide more services through extra opening hours and same-day appointments. We will retain 2 minor injury units, but we want you to advise us on the opening hours for these. To help you understand our proposals, here is a summary of what is urgent care. A minor injury unit is a department that treats non-serious injuries such as sprains and strains. They are an alternative to attending A&E in your local hospital where your injury is not life-threatening. Walk-in and urgent care centres assist patients who have an immediate but not life-threatening illness that can't wait for an appointment the next day. Extended services means that GP practices, or a group of practices known as a hub, would offer additional appointments beyond 6 p.m. on weekdays and additional weekend opening. This follows government policy. A hub arrangement is a group of practices working together from one site to serve a larger population. Enhanced services would entail GP practices seeing more patients during the day that require same-day urgent access. There are 40 GP practices in Durham Dales, Easington and Sedgefield. They are the only service to hold a complete patient health record. Durham Dales, Easington and Sedgefield CCG currently pays providers each time a patient uses healthcare. The following are examples. Easington Walk-in Centre is paid £34 per patient visit. Peterlee and Bishop Auckland Walk-in Centre, Urgent Care Centre and GP out-of-hours services are paid £76 per patient visit. An A&E department is paid an average of £128 per patient visit. This is in comparison to us paying £76 to GPs per patient per year to cover all visits and care. Here's some patient data from our current services. In Bishop Auckland, we see 57,000 patients per year, and these are mainly young children and young adults. Most demand is during normal GP opening times, and the majority of patients are registered with a Bishop Auckland GP. In Peterlee, we see 52,000 patients per year, and these are mainly young children and adults. Most demand is during normal GP times, and more people walk in than at Bishop Auckland. A third of patients are registered with Peterlee GPs. In Seaham, we see 11,000 patients per year, and most common are young children. All visits are during normal GP opening times, and the majority are walk-in patients who are also registered with a GP in the same building. In Easington, we see 20,000 patients per year, and these are all walk-ins. Nearly half of the people we see are registered with local GPs. Here are the options we are consulting on. Option 1. This option features minor injury units opening 12 hours a day from 8 AM until 8 PM, retains existing out-of-hours services, and has up to 3 GP hubs in each locality, opening until 8 PM on weekdays and 8 AM until 1 PM at weekends. Existing GPs would manage minor ailments, and there would be more use of NHS 111 for appointments, assessment and signposting to services. Option 2. This option features minor injury units opening 12 hours a day from 8 AM until 8 PM, retains existing out-of-hours services, and up to 3 GP hubs in each locality, opening until 8 PM on weekdays and 8 AM until 1 PM at weekends. An enhanced GP service would manage minor ailments in every practice or hubs, and there would be more use of NHS 111 for appointments, assessment and signposting to services. Option 3. This option features minor injury units opening 24 hours a day, retains existing GP out-of-hours services, and has up to 3 GP hubs in each locality, opening until 8 PM on weekdays and 8 AM until 1 PM at weekends. An enhanced GP service would manage minor ailments in every practice or hubs, and there would be more use of NHS 111 for appointments, assessment and signposting to services. The main proposed changes are for daytime urgent care treating minor illnesses. These are currently provided from Bishop Auckland, Easington, Peterlee and Seaham. We're asking the public to recommend where they think our extended opening hours GP hubs should be located. We're also asking for your views on opening hours for minor injury units. We're keen to hear from you. Here's how you can have your say. Attend one of our public events, read our documents and complete an online survey at www.gettingcarerightforyou.org.uk. Email us at ddesccg.enquiries@nhs.net. Write to us at Durham Dales, Easington and Sedgefield CCG, Sedgefield Community Hospital, Salters Lane, Sedgefield, TS21 3EE. Call us on 0191 371 3222. You can also visit our Facebook page or tweet us on @DDESCCG. Getting care right for you. The future of urgent care services in Durham Dales, Easington and Sedgefield.